Hello, and welcome to today's presentation of our Tackling Toileting webinar series. Today is the third webinar in our series, and it looks at daytime toilet training. My name is Kristen Gunby, and I'm a behavior analyst and part of our subject matter expert team here at Autism Ontario. I'm joined by my colleague Bethany Bruin, who is an occupational therapist and also part of our team. For more information on Autism Ontario's language and professional statements, please see the document listed in the resource window. This presentation is pre-recorded. After the recording plays, we will be here live to answer your questions. Please submit your questions in the Q&A box below, and we will do our best to answer as many as we can. So we're going to pick up where we left off, and if you haven't had an opportunity to view part 1 and 2 of this mini-series, the link to access that is in our resource section as view on demand, register for upcoming sessions. Today is part 3 in our mini-series, and we will be sharing information today about daytime toilet training for both urine, pee, and bowel movements, poo. Just a reminder that the content of this mini-series is from our new toileting guide, so if you have a chance, you should take a look at that in the resource section as well. It can be found in our resource window directly under the slides. It's listed under presentation slides and resources. So we're now going to talk about daytime toilet training for urine or pee. Let's start by taking a look at some of the readiness indicators for toilet training. Now, these readiness indicators are from research in pediatrics, so this is not specific to children with autism, but it might help bring your attention to some of the things to watch for. Having said that, there's been a number of different studies with individuals with autism where they successfully learned to pee on the toilet, and the participation criteria in those studies was actually quite simple. Parents indicated that this was a goal and that it was important to them, and the individual was not yet toilet trained, and there wasn't any mention of these readiness skills. So while your child may show indications that they're ready to begin toilet training, others may not, and that's not necessarily an indication on whether toilet training will work or not. The first thing we wanted to mention was that it's always a good idea to speak with your family doctor or pediatrician first to rule out medical reasons for daytime pee accidents. Once you've received clearance, you can access the support of a board-certified behavior analyst or an occupational therapist for support with daytime toilet training for pee. Typically, the focus of teaching a person with autism will be around successful urination on the toilet, so peeing in the toilet or aiming into the toilet if standing, staying dry while off the toilet, so that bladder control, and self-initiating when the individual feels they need to urinate or asking to go, communicating their needs. So next, we're going to talk about common teaching components that have been published in research studies that a lot of clinicians use because the strategies have proven effectiveness. But we want to remind you that not all teaching strategies are appropriate for all children. Each of your children are unique and they have their own learning style, and so it's helpful to check with a professional that you're working with to help you understand whether these strategies would be a good fit for your child. So some interventions may include the removal of diapers during the day, and that's to help your child feel when they've had an accident. Diapers have really improved with technology and they whisk away the moisture, which can make it hard to tell when you're wet. Increased fluid intake. So this can help at the start of toilet training to increase opportunities to urinate on the toilet. Teaching a way to communicate. So using that established communication method we talked about in part 1 of this series to now indicate when someone has to go to the washroom. Sometimes this can be prompted just before the person's taken to the washroom. And then we have frequent scheduled bathroom visits. So different intervention methods in the literature had different starting intervals, maybe taking every 5 or 10 minutes. A lot were frequent bathroom visits to start, and then gradually increasing the time between bathroom visits later. And this can give your child a chance to feel a full bladder and to communicate the need to go pee. As Bethany mentioned in part 2 of our mini-series, that notion of introception, moving from using the toilet on a schedule to self-initiating and communicating the need to pee. Then we have the use of task analysis. So we talked about this again in part 2 of our mini-series. So this is a visual or a written schedule that can be posted in the bathroom of what needs to be done. So going to the washroom, putting the lights on, closing the door, taking the pants down. This can help your child remember what they need to do once they're in the washroom. And then we have practicing using the toilet in different washrooms. This was a component that was used early on, and this can help so that individuals don't become used to just one particular washroom, but they start getting used to multiple washrooms. Positive reinforcement or rewards for successful peeing in the toilet. So if you're in an ABA program, you'll probably be used to this. We want to acknowledge an individual's efforts and keep the experience positive. So we celebrate when they urinate by providing a special item, activity, or praise following urination or pee on the toilet. Often there can be reinforcement for any bowel movements on the toilet at this point as well. A lot of clinicians will also be prepared and consistent when accidents occur. And they'll have a consistent response. So this can include having the child help change themselves, or maybe the team will decide that they'll redirect the individual to the bathroom. So if they start with an accident and they're redirected, they can finish on the toilet. Sometimes there's the use of a moisture sensing alarm, and this can help with awareness. So the alarm hooks up to your child's underwear, and it's set off when it senses moisture. And this can bring awareness to the child and those supporting them that it's time to try to get to the bathroom. It's best to purchase these when you work with a professional, and this is to ensure that you find an alarm that works best for you and your child. And then lastly, we have data collection or a P journal. So this can help keep track of your child's success and challenges with toileting. Data can help us see progress, and in this way we can keep what's working or we can modify and change what's not working. Here is a sample toileting journal, and this resource is available in our toileting guide in the resource section. This data collection system can help you record your child's progress and their starting point being baseline, and progress after you put strategies into place. If you're working with a professional, you may want to connect with them first to determine if they have their own journal or data collection system. They may ask for some additional information like fluid intake. Next, we're going to talk about daytime toilet training for poop. Some urine training programs will include rewards or positive reinforcement for appropriate bowel movements, otherwise known as poop on the toilet. And this can sometimes lead to improvements in bowel movement accidents as the child learns to use the toilet for both urine, pee, and bowel movements or poo at the same time. So some individuals actually might not need programs that specifically target bowel movement trainings, but others may need some more support. It's important that you and your team collect data for both urine and bowel movements, and this helps us determine if additional training is needed for bowel movements or poop. And now I'm going to turn it over to Bethany.
Thanks, Kristen. So now we're going to talk about what those daytime poop accidents look like. So daytime poop accidents are sometimes called fecal incontinence or encopresis. And this is when an individual has a bowel movement, or sometimes called a stool or a poop, at unwanted times and outside of the toilet or the potty. And there can be many explanations for fecal incontinence that may be related to things like gastrointestinal issues, neuromuscular issues, behavioral, or social and emotional processes. Another issue is related to constipation, and we'll talk about that in a little more detail. So what is constipation? And as defined by the Rome Foundation, a child is considered constipated when they show some or all of the following signs for an extended period of time. So this means that it's happening at least once a week and has been going on for at least a month. They may show signs like they're pooping less than 2 times a week. They're voluntarily holding in their poop. The poop is usually hard and lumpy. Pooping seems to hurt, or when your child poops, it seems very large or may clog the toilet. And how does this constipation affect our toileting then? The added challenge of constipation is that when a child has a large amount of poop inside that isn't coming out, it can lead to poop accidents. So for example, when there's a hard mass of stool or poop in the rectum, so that's the last part of the digestive system, softer stool, so that newer stool, can often slip around and cause those poop accidents. So we call that rectal overflow. Constipation can also lead to toileting refusal, where your child may become fearful of painful bowel movements. So it hurts when they poop. So, who can we ask for support for constipation or help with issues like fecal incontinence? Of course, we can always speak with our family doctor or pediatrician, especially in cases of constipation. We want to rule out those medical reasons for daytime poop accidents. A gastroenterologist. So this is a specialist that if your child's experiencing severe or prolonged challenges with pooping, your doctor or pediatrician may suggest a referral to a specialist. And if you're looking for strategies related to toileting for bowel movements, again, you can work with an occupational therapist or a board certified behavior analyst. In this case, you may also want to consult with a registered dietitian. They may have some recommendations around dietary needs related to bowel movements. So now we're going to talk about some common strategies or common teaching strategies related to toilet training for bowel. And there's many approaches. Many of these strategies that we talked about during daytime toilet training for pee are also useful for daytime toilet training for poop. So those examples would be things like scheduled toilet sits, rewards or positive reinforcement for successfully pooping on the toilet. But because poop can have more considerations such as diet and functional constipation and withholding, then it's often helpful to use a multidisciplinary or an interdisciplinary approach. So we've got lots of members of our team and lots of professionals working together. So your team of professionals may make some of the following recommendations. They may suggest education on the physiological and behavioral processes of bowel movements. So teaching your child how we eat and how we have bowel movements, how that process works. There may be behavioral interventions. So again, establishing bathroom routines, looking at toileting schedules, that positive reinforcement for successfully voiding on the toilet. Medical interventions may include things like laxatives or enemas, and that's where your medical team is looking at maintaining those soft, well-lubricated stools to make it easier and less painful for pooping. Good perianal skin care. So for example, your doctor may prescribe a cream or a lotion to help heal and protect your child's bum. And finally, as we mentioned, those dietary and fluid interventions. So consulting with a dietitian may support with for example, increasing fiber intake. So to summarize today's discussion about daytime toilet training, here are some key takeaways. There are many teaching strategies that can help your child with successful urination or pee and bowel movements, poop on the toilet. And you may wish to consider an interdisciplinary approach, so a team of professionals to support you and your child and their unique needs. And now we'll have an opportunity for questions. Hi, everyone, and welcome. So this is the live question and answer portion of today's presentation. And just a reminder that you can register to view the previous sessions. And we do have one more session after this one that will be speaking about challenging behavior as well as bedwetting. So stay tuned for information about that. And we'll try to get to as many of your questions as we can today.
We also just want to remind you guys that while not all of the strategies that we talked about today are going to be appropriate for every child, so just be sure to check in with the professionals that you're working with to determine which strategies are a best fit for your son or daughter.
So we do have lots of questions. The first one is around getting your child to ask to go to the potty and how to keep them aware of being wet. So we've talked about this in a few different ways. We're talking about that sort of internal sensation or that internal awareness of needing to go. And then if they've already gone, maybe they've peed in their underwear or in their diaper, having that awareness that they've gone to the washroom and that they need to get changed, or how we can prevent that from happening perhaps in the future. So part of that is teaching too around the concepts of wet and dry. You might want to, if you're working with an occupational therapist, they may have a sensory approach where maybe you're using a sensory bin and you're exploring different textures and sensations so that you're developing some awareness around what it feels like for your hand to feel wet and your hand to feel dry, so we can attach some of that language when we transfer that over to toileting.
And just as we talked about, removing diapers during the day has actually been shown in the research to support with awareness because, as we mentioned, diapers whisk away the moisture, so it can be hard to tell whether you're wet or not. We understand some children do not mind being wet, and so there's some other pieces that you can use as well, like a moisture sensing alarm. Those hook up to your underwear and they detect moisture and they set off an alarm. You want to make sure you're working with a professional when you choose those alarms. Some of them make really nice sing songs as their alarm, and sometimes that can be confusing because maybe the child might urinate so that they can hear that alarm, and some of them might be a little bit too loud and scary, and so you want to find one that's just right for your child. But those can bring awareness to the child themselves as well as those around them that it might be time to head on over to the washroom. And then also those frequent scheduled sits to start. So you're going to have your son or daughter go to the bathroom more frequently in the beginning stages of toilet training, and then slowly start increasing that interval over time to give them a chance to show their awareness and that bladder control and indicating to you that they need to go. So it's a process.
Thanks, Kristen. And I think that also addresses, we had some questions around older children still struggling with toileting, that feeling sensation piece, leaking small amounts throughout the day. So certainly those strategies that Kristen just spoke around at the moisture sensing alarm and those scheduled sits can help to address that as well. So we have a question around, similarly, how do we make a child to sit for longer in the toilet? So a child who's maybe sitting while he's peeing, or he or she is peeing and then not staying long enough to sit for pooping. So in our previous presentations, we talked a little bit about the environment. That would be the first thing that I would want to sort of problem solve around, is making sure that we do have a comfortable seated space or environment. So where a child's feet are supported, where they're feeling like they're stable, so they can sit for those longer periods without feeling uncomfortable or feeling like they're going to fall, feeling unstable. And then also having maybe a motivating factor. So we talked about things like having a special book or a special song or a special activity that you do together while your child is doing those scheduled toilet sitting times. And we can also look at using a timer too, so that where it's not necessarily the goal is that they're sitting until they poop, but they're just sitting that little bit longer each time. So maybe they've already sat for long enough and they've had a chance to urinate in the toilet, but we're extending that time just a little bit longer each time.
I see some questions here just about children that don't want to go into the washroom in the first place. That's definitely a common struggle. There's a lot of unpredictable things that can happen, especially in public washrooms, like hand dryers and flushing sounds, or maybe they went to the washroom one time and the water splashed up on them and it wasn't a great experience. And so maybe they need a new learning history with the washroom. And so maybe we take a pause from actually expecting them to urinate or have bowel movement on the toilet. And we just try to, like Bethany mentioned, create an environment where they're comfortable. Maybe it's just about going into the washroom. And so something that they really enjoy is just kind of sitting on the countertop to start. And you just kind of break down the steps of getting into the washroom and start acknowledging through positive reinforcement just small little steps into the washroom. Maybe they just need to go in and grab something and they can leave, and just keep it short and successful until you can kind of build back up to sitting on the toilet. I also see here, where do you get those wetness alarms? So that is a good question. They are available at the bedwettingstore.com. I'm sure there are other online ways to get those. The Malum seems to be the one that is the most popular. Again, make sure you're looking at what the alarm sounds like. You want it to bring awareness. You don't want it to be too scary, and you don't want it to be too delightful and fun that then it becomes a little bit of a game that I'm going to urinate so I can hear this sound. So it's really about finding the right alarm for your child.
Thanks, Kristen. We have a question around my son was able to hold pee for more than 3 hours, but now he's wetting his underwear and not able to hold for even a short period. So that's another piece where we'd want you to check in with your medical team first, with your family doctor or your pediatrician. If you're noticing any changes in your child's habits in terms of how long they can hold their pee for, just to problem solve around any medical issues, perhaps urinary tract infection, anything else that's going on. And then you can also keep an eye on any of their daily habits. So that data collection piece that Kristen spoke about is really important, where you can sort of track when they're eating, when they're drinking, what kinds of activities are happening surrounding those sort of changes in what their toileting habits might be.
Is there a time that's too long for an individual to sit on a potty? Is the next question. An individual here is sitting for 30 minutes, and then as soon as the diaper goes on, then that individual will urinate. So there was actually a really neat study published where they actually had the child sit on the toilet in their diaper, and the diaper had a little bit of a hole in it, and gradually over time that hole got bigger or bigger, bigger and bigger until it was just off. And so sometimes you can get creative that way and slowly fade out the presence of the diaper, especially if somebody just really has a strong need to go in the toilet, that you're finding that the scheduled sit time is not working very well. And as soon as that diaper goes on, then they go. You can work that way.
And I think that's a great strategy too to address around. There's a question, my little guy goes and hides in his room or behind a chair to poop and doesn't like anyone around to poop. How can I get him to start using the potty to poop? So we see that quite frequently. And I think we spoke about that in our last session, just around the positive aspect of that is that we're noticing that they do have some of that awareness, right? They're noticing that it's time to poop, and then they're sort of taking their preferred place or time where they're going. So we can work around that. If you do have a portable potty, a small child-sized potty that can be in sort of the preferred area that they're choosing. Kristen spoke about sort of fading out the use of a diaper. So maybe having a hole cut in the diaper so that they can start to transition that way.
Yeah, and just to piggyback on that, having that potty or something that's portable, whether it's commode for an older individual, go close to them while they're having that time when they have a bowel movement in their diaper, wherever they're having it. They are indicating that they know something's happening and they want to go to a preferred, comfortable area. And so making that area look more like a washroom and then slowly fading it back into the washroom. An occupational therapist or board certified behavior analyst can certainly support you with a plan of action for that, so that it can be done systematically and they can collect data or gather information and help kind of tweak things as needed.
We have a question around childcare. So some children refuse to poop or pee at childcare, even when they're potty trained at home. What are the things that we have to have in mind and observe to support these children? So that's a great thing to be aware of. And I'm really glad you're asking that question, because again, we're thinking about those sort of differences maybe in the environment. And this could apply to school too. So thinking about the difference depending on your childcare setting. Are there multiple bathroom stalls in the same bathroom? Is the bathroom close to or far away from the classroom? Does the child need to stop what they're doing when they're engaged in something fun to visit the washroom? And sort of what that schedule or routine looks like, maybe compared to what they're doing at home. So it's always helpful to have that conversation. If you are an educator or a childcare worker, to have some of those conversations with the caregivers or the family to see what they're implementing at home, what the routine looks like, and how you can maybe adapt. The other thing that I might consider is just sort of what your daily schedule looks like. So if you have really exciting, fun, active activity, maybe you're playing outside, when your toileting routine is scheduled. So maybe we have something a little more quiet and relaxed. Maybe it's story time or a fine motor tabletop activity. And that's when we're transitioning to the washroom if you're noticing maybe some anxiety or some hesitancy around visiting the washroom. So just kind of problem solving around what that timeline looks like.
I saw a question here. So, how do you support with toilet training at school when an ABA therapist or whatever professional can't go into the school? So, I used to work for the public education system, and you can definitely request that they communicate with each other. So, any outside therapists or professionals, see if they're willing to connect with school and vice versa. It doesn't necessarily mean that somebody has to go into the school to train the staff, but if they can get on the same page in terms of what's working, what scheduled sit times, for example, they can start with, and then maybe asking if there could be a communication book that kind of goes back and forth between home and school, and then the parent can liaise with whatever professional is working with that individual, just keeping the lines of communication open. You can always work on things during breaks like summer or winter break, but you will need to communicate or have professionals attempt to communicate, because that individual will have to use the bathroom at school. And so as much fostering of that bridging of communication that you can do, the better.
Thanks, Kristen. I think that also we have lots of questions around school and sort of what that looks like at school. A child who never asks to go at school and is defiant when they ask her to go. There's another question around sort of specific intervals and timing and data collection at school. So just back to what Kristen was talking about, that communication process with your school team and sort of problem solving around what that looks like.
Yeah, and when I used to work for a private ADA company, if we had a short sit interval, then we would be working with the family and the school to say, okay, well, maybe we can transition this to school when it gets to a more reasonable sit schedule. And so there's a lot that can come from those open communication pieces and meetings in terms of what's reasonable in different environments. What does the washroom look like? Can we use a single stall washroom to start, or will we be using a washroom with a lot of stalls and with hand dryers? And so keeping the lines of communication amongst your teams is definitely key with toileting. Okay.
So there's lots of questions around sort of the difference between when children are toilet trained for pee and not so much for poop. That seems to be a fairly common trend.
Yeah, I see here. My son does not want to sit for bowel movements, and he has bowel movements at night. Any suggestions with how to deal with this? That would be really hard for us to answer without doing an assessment or meeting or seeing the individual. But one thing we can suggest is to start looking at that interdisciplinary team approach. Because if the individual is going at night, maybe you can meet with a medical professional or a dietitian who can help with maybe having bowel movements be more frequent, so that if there are some scheduled sits, it might be more successful with some of those medical or dietary factors included. So maybe recruiting more of an interdisciplinary team approach.
Yeah, and I think it's important to note, we sort of highlighted in the recorded part of this presentation that sometimes around poop, there are issues where if they've had an experience of having a painful poop, if they've had diarrhea that's felt as kind of scary for them, if there's any sensory components about, water splashing back or noisy automatic toilets, sometimes that can be tied into those experiences that are different for poop versus pee. So always important to check in with your team. Yes, I think there's a question that speaks directly to that. How can you reassure your child to poop in the toilet and not be so afraid? So that's going to be that problem solving process too, around maybe what their experience looks like. And sometimes it is related to painful pooping. So it's always good to check in with your doctor, pediatrician, just to kind of rule that out.
Okay, I see tips for how to explain or words to use for a child that's around 3.5 years old, to teach the sensation or signs that the child should be looking out for before they have to go. So that communication piece. So we had talked about the scheduled sit times and a moisture sensing alarm, and then prompting communication. So If that happens with the urine alarm, prompting the individual, because you know that they're starting to go, prompting the individual to use that communication method that we talked about in part 1, just to say that they have to go pee or poo, whatever that looks like, whether it's AAC or vocal communication. I would keep it simple at this stage. You really want to link those words to what's happening. So whether it's pee or bathroom or toilet or poo, and prompting before those scheduled sit times too. So right before they sit, prompting them to say that. And then over time, we're hoping as those scheduled sit times become less frequent, it gives that child an opportunity to recognize that feeling and say it themselves. Okay, so we're just about out of time. We want to thank you guys for joining us again. We hope that we see you for part 4, and please fill out our feedback survey.
Thanks, everyone.